Ladies and gentlemen, Dr. Katherine Nordal.
No dance steps this year. I might fall right down here in the North Carolina. Somebody challenged me to that and we just couldn't find the right music, so no dance steps, sorry. Good afternoon. Oh, a little louder, wake up, you've had a big lunch. Good afternoon. Yeah. Welcome to Washington. Welcome to our 2016 State Leadership Conference. It's really great to see all of you here. I'm really heartened to see the number of first-timers as well. And I'm very pleased to welcome all of you who are first-timers. It's been quite a year for APA, as many of you know, and it's been a challenging year for your practice organization. I know how troubling and painful these last 8 months have been for you as members, as psychologists, and as state leaders. The independent review sent shockwaves through APA, through its staff, through its members, and the psychology community at large. It is certainly going to take all of us some time to heal, but I do believe that the association is moving in the right direction. A newly appointed ethics committee will be examining and making recommendations about ethics policies and procedures in APA, and examining the role of an ethics office and an ethics officer and committee within the APA. This new commission, which was just announced this week, has 17 members, 9 of whom are psychologists, and I see Dr. Erica Wise in the room. She's one of the psychologists. Are there any other psychologists on the commission that are here at the meeting? Dr. Erica Wise. And 8 of the remaining commissioners come from related fields of medicine, law, and ethics. It is really a stellar group. The commission is jointly chaired by Dr. Melba Vasquez, a former APA president, author, and ethics scholar, and Dr. Paul Root Wolpe, who is the director of the Emory University Center for Ethics. A new work group has also developed a set of conflict of interest policies and procedures for APA governance and staff. And there are a number of other post-independent review resolutions that will be coming out of the board and council. You will have the opportunity to address many of these issues and other issues as well with Dr. Cynthia Villar and Dr. Susan McDaniel at a plenary session on Monday afternoon. This is an open forum, so you will be able to voice your concerns, ask questions, hear about Dr. Villar's plans for APA, as well as Dr. McDaniel's initiatives. Certainly another distressing matter for members has been the practice assessment lawsuit settlement. I know a number of you, because I've heard from many, were very frustrated by the settlement process, which was handled totally outside of APA by an independent administrator. But more importantly, and what concerns me the most, is the disappointment and the loss of faith that some of you and your colleagues felt or may still feel towards APA and towards your practice organization. On a personal level, as your colleague and as a member of APA, as a staff member, and as a psychologist, I feel and understand your anger, your anxiety, and your frustration. We are committed to being more transparent, communicating more often and being in dialogue with you, and finding ways to engage more of you in the work that we're doing. And it is my sincerest hope that we can find a way to earn back your trust as we continue our work together to build a great future for our discipline and our profession. Our State Leadership Conference has always been an opportunity for you psychologists to come together, to exchange knowledge, to share your expertise, advocate for professional practice, and tackle some of the major issues confronting our profession. Over the years, State Leadership Conference has become a wonderful melting pot, which is very obvious as we've had several of the different constituencies stand up, representing several generations, various work settings, and cultural and ethical backgrounds. Those of you here at the conference represent a range of work settings, including private practice, but even more so including academia, hospitals, clinics, nursing homes, university counseling centers, and a variety of other settings. This year, 30% of you are early career psychologists. So there is much dark hair in the room as opposed to a lot of gray hair like I've been developing. State leadership is a major training ground. For those of you who have been here, you certainly appreciate that, but a major training ground for leadership and advocacy for our students, for our early career psychologists, and for our diversity delegates. And what a great group of diversity delegates we had. I had the honor of attending their dinner last night. A number of folks in this room, as a matter of fact, got their start as an SLC diversity delegate. One of them is sitting right over there with the Minnesota group, Dr. Bravada Garrett-Akinsanya. She is the current president of APA's Division 35, which is the Society for Women, a member of our CAP and the APA Council, and she was the first African-American president of the Minnesota Psychological Association. Dr. June Ching, our CAP co-chair, our vice chair, I should say, was a diversity delegate, has been a state association president, and has been a recent past president of Division 42, the Division of Independent Practice, as well as a council rep. We've also watched our early career psychologists move up the leadership ranks as well in their state and provincial associations. In the House with us tonight, if he would raise his hand somewhere, Dr. Jamie Brass, president-elect of the Utah Psychological Association. Sorry, did I say he? I meant she. First attended as an early career psychologist. Dr. Zoe Proctor-Weber, president of the Florida Psychological Association. Dr. Lisa Lenning, an APA council rep for Nevada, are both past early career delegates to the State Leadership Conference. So to all of the graduate students, the diversity delegates, and early career delegates here at SLC, we have really high hopes for you. You are our future leaders, and we trust that you will lend a hand to those coming behind you to help groom even another cohort of psychology's leaders. Yeah. Whoever that was, woo! So, in spite of what has been, I think, since in my 9 years here at APA, a difficult and challenging 2015 for all of us, your practice organization staff and governance members have continued to work for you, for our profession, and for the patients and clients that we serve. In 2015, the practice organization provided $480,000 of grants for organizational development, legislation, and emergencies to the states and Canadian provincial psychological associations. The Georgia Psychological Association received a grant to support efforts to clearly define psychological testing in the state licensing law. And we know how important that is because we know what's happening to that part of our scope of practice out in the states. The Michigan Psychological Association received a grant to support efforts to pursue legislation, another very important one, to protect the doctoral standard for the practice of psychology and the use of the title psychologist. The Ohio Psychological Association received funds to address reimbursement issues related to retroactive rescinding of prior authorization of treatment that had been approved by insurers and then they decided not to pay. And West Virginia received a grant to pursue a sequence of training bill. So lots of important stuff that these grants go to support to protect that practice at the state level. These are just a few examples of how the states have benefited, both through our finances as well as collaboration with them. Thanks to more than 10 years of legislative advocacy by the practice organization, in collaboration with other health professions, Congress finally repealed that sustainable growth rate cut. And good for us. And by doing so, we averted a 21% reduction to your Medicare fees starting this year. As a result of our grassroots efforts and the work of our practice organization's government relations staff, The Medicare Mental Health Access Act was introduced this past December by Representative Kristi Noem, a Republican from South Dakota, whom, by the way, we will be honoring at our banquet Monday night, and Illinois, go South Dakota, and Illinois Representative Jan Schakowsky, a Democrat and longtime champion for psychology. Just this Thursday, our physician definition bill was introduced in the United States Senate by Susan Collins from Maine and Sherrod Brown from Ohio. So when you go to the Hill on Monday, we've got bipartisan legislation in both houses to include psychologists in the physician definition in Medicare. Which I might add is sort of like long overdue. It will allow us to practice to the full extent of our licensure in the Medicare program, free of unneeded physician supervision, which in many areas creates real problems and extra expenses in healthcare systems. Psychologists are the only doctorally trained healthcare professionals in the Medicare program who are not in the physician definition. It took us a long time to get into Medicare, about 25 years, and now it's taking us about another 25 to try to get in the physician definition, which, oh, by the way, happens to include podiatrists, dentists, chiropractors, and optometrists. And folks have a problem with psychologists. I don't quite get that. The practice organization is also supporting the Helping Families in Mental Health Crisis Act. This is a bill introduced in the House by, again, one of our own Pennsylvania psychologists, Tim Murphy, and his colleague, Texas Representative Eddie Bernice Johnson. This legislation aims to improve access to effective evidence-based care. I know that Dr. Evans likes to hear about that, particularly with those with the most severe mental disorders, and also includes additional training dollars in addition to GPE for psychology training. We're also supporting the Mental Health Awareness and Improvement Act of 2015, introduced in the Senate in December by Lamar Alexander from Tennessee, and another one of our champions, Patty Murray from Washington State. This legislation focuses on suicide prevention, mental health care for children and older adults, and the integration of mental and physical health care. So you'll get a lot more information about these bills during your Hill briefings tomorrow and Monday, and you've got a heavy load to be carrying to the Hill on Monday about lots of stuff that is really good for the patients that we serve. For those of you who are Medicare providers, and I might add many of our colleagues have decided to opt out of that program, but for those of you who are Medicare providers or thinking of becoming one, there's a workshop on Monday that I think is really important for you to attend. It's called Medicare: Finding Your Way Through the Maze. And that's probably an understatement of what that workshop will be about. You'll have the opportunity to learn about changing Medicare regulations and the Physician Quality Reporting System, also known as PQRS. PQRS is a mandated program for Medicare providers to submit data that you collect on your patients in the process of treatment. And you submit that on an annual basis to CMS along with your claims, or have been with your claims. PQRS used to be, for those of you who have been in the program, have an incentive-based component. But now it's only a penalty-based program. So if you do not report these quality measures, you will find that your Medicare fees will continue to be reduced year after year. We know that reporting these quality measures has been a very difficult and frustrating process for a lot of clinicians. So to help ease the burden of that reporting, we teamed up last year, end of 14, with HealthMonix to create a registry which we call APAPO PQRS Pro. That's a big mouthful. Increasingly, Medicare is developing new mental health measures which can only be reported through a registry. So they are moving towards eliminating individual claims-based reporting and moving towards registry reporting. So if you're a Medicare provider, be sure and attend that workshop. It will provide for you a lot of very helpful information. Another important aspect, of course, Dr. Puente is well aware of this, is the work that we do around reimbursement codes and reimbursement involving the CPT and RUC processes at the AMA. We have an Office of Healthcare Financing attached to our Center for Psychology and Health. That office is headed up by Dr. Randy Phelps. He spearheads our work in not only the development of procedure codes for psychologists to use, but also the evaluation of those codes. That work impacts not only what Medicare will pay and allow, it impacts the Medicaid fee structure, and perhaps even more importantly to some of you, it impacts what the commercial carriers will allow for psychological and testing services. A substantial portion of the work, though, of the Office of Healthcare Financing is actually supported by your practice organization budget because of the nature of that work. You might be glad to know that just this week we launched a new series that Dr. Phelps and Debbie Lanzi in his office will be authoring. It's called Up to Code, and it will be in your Practice Update e-newsletter with lots of good information to keep you up to date on what you need to know about coding issues, both in regard to Medicare, Medicaid, and commercial carriers. We continue to have a substantial Medicaid agenda in practice. And the reason for that is that Medicaid is the single largest payer of mental health and substance use services in this country, bar none. And we anticipate that it will continue to grow in terms of its importance in funding those kinds of services. In 2015, we advocated very successfully for the expansion of psychological services and reimbursement in the Medicaid system. Currently, our staff is working with several states, among them North Carolina and the District of Columbia, on these issues. In 2015, the Education Directorate allocated some money for a Medicaid Policy and Advocacy Fellowship position, which is currently occupied by a healthcare attorney. She works with us in practice to help remove barriers for not only psychologists, but also for interns' participation in the Medicaid system. And several states have been successful in getting their interns reimbursed. Very importantly, these services will increase and enhance care for the underserved population. And we are hopeful that secondarily, to some of you primarily, that it will help ease our internship imbalance by making internship slots more economically sustainable and helping to financially support those internship programs. We are thrilled to be working with education on this. We understand how critical the internship imbalance has been, and we want to make sure that all of our students in the pipeline can get the very best training available, and we think this is going to help with that. In 2015, we saw the fruits of our labor from several years of work by our very capable legal and regulatory attorneys in practice with commercial insurers, working with commercial insurers. They persuaded Anthem to fire Sante Analytics as its auditor and stop abusive audits of psychological and neuropsychological testing. When we gave this report at council last week, or part of it, one of the council members came up to me and he said, you know, I used to get those audits all the time. And he said, all of a sudden they stopped, and now I understand why. It was because of the work of our legal and regulatory department. And as a result of the practice organization's advocacy with insurance companies to properly implement parity, you may not know, but there were some insurance companies that were paying the same dollar amount for a 45-minute therapy session as they were paying for a 60-minute therapy session, and they are no longer paying the same rate and are actually paying a higher rate for the 60-minute therapy code. On a daily basis, our legal and regulatory staff field calls from thousands of practice organizations, in a year, thousands of practice organization members around a lot of different issues. The phones ring regularly about things like HIPAA compliance, record keeping, electronic health records, telepsychology, scope of practice, licensing issues. Oh my God, the deputy just arrived in my office with a subpoena. What am I supposed to do? Duty to warn, and working with individuals around abusive insurance and managed care practices. We handled more than 1,000 of these types of calls in this last year. This year, there's been a lot of hype around the presidential election. I'm sure many of you have been watching the caucuses and debates with interest like I have. But there's another election that we really need to pay attention to this year. One of our own, Dr. Ted Strickland from Ohio, where's you Ohio folks? Is running for the United States Senate. Now, some of you may not know that Ted was the first psychologist elected to the U.S. House of Representatives. He's always stayed true to his roots as a psychologist and maintains his APA membership while serving in the Congress and when serving as governor of Ohio. He will be joining us here tomorrow at State Leadership. I encourage all of you to please show up at the reception that we will be having for him. Come and meet Ted, get to know him, lend him your support. Let's help elect the first psychologist ever to the United States Senate. And tomorrow morning, you're going to get to hear lots of interesting stuff about the political landscape and how it might affect professional psychology. We'll be joined by well-known journalist and political commentator Mark Shields. Many of you may remember the Brooks and Shields on Friday night on PBS, and then he is a regular panelist on Inside Washington, the weekly public affairs show that airs both on PBS and ABC. Mark has worked in Washington through 10 presidential administrations. He was with us about a decade ago, I think. He has spoken at State Leadership once before. I look forward to his thoughts about this current and, what can I say, really wacky presidential campaign. So I'm sure Mark will have some interesting comments. It'll be interesting to see what he thinks about Chris Christie's endorsement of Donald Trump. So somebody throw that question out to him tomorrow. And for the first time in SLC history, our federal advocacy coordinators are teaming up with our public education campaign coordinators in holding a joint workshop on how public education can help foster relationships with policymakers and bolster our federal advocacy efforts. So I hope that all of you folks will be great tweeters and Instagrammers and whatever all we're going to do to really be getting those words out. We're also going to spend some time talking about association membership. Events, as I said earlier, like the independent review and the practice assessment lawsuit have impacted membership, particularly in the practice organization. And I would imagine there's been some trickle down to the states. We'll address a lot of membership issues during Monday morning's plenary sponsored by CESPA. If membership is a challenge for your organization, and I doubt that nobody would not hold up their hand, you'll want to be there. It's a catchy title, all about members, how to get them, how to keep them, and how to satisfy them. And you'll have a chance to meet APA's new Executive Director for Membership, Mr. Ian King. So at this SLC, we're going to have a lot of programming as well about both new and traditional models of providing psychological services. We'll look at real-life examples of innovative practices, ranging from simple options that most psychologists have the capability of implementing in their own offices, to large, complex, integrated systems and models that can provide really great new opportunities for entrepreneurial psychologists. And we'll explore how psychologists can participate in integrated, evidence-based systems to improve patient care. This year's opening session and the theme of SLC, Expanding the Practice Spectrum, grew out of a successful multi-state summit that some of you have already heard about in integrated healthcare and alternative practice models that was held in New York City last May. That summit was a collaborative effort of the practice organization and several state associations. It was designed to help psychologists learn the nuts and bolts of getting involved in, working with, and even developing systems of care that promote the integration of mental and physical health services. Today's opening session, as well as 3 additional workshops, will focus on the practical skills and information you need to help your members successfully navigate this evolving healthcare system. We have some incredible psychologists out in the field doing really innovative things with group practice structures and integrated care systems. And we also have psychologists who prefer to remain in the traditional and very successful fee-for-service practice model. We need all of you to continue to demonstrate the real value of psychology as a health profession wherever it's practiced. So that's why this year's programming focuses on skills and advocacy needed to support the entire range of traditional and new practice models. For those of you who have been here before, this opening session is a little different format from previous years where typically I've spoken and then we've had somebody else from outside of psychology typically come and speak. This year we have 3 keynote speakers, all psychologists, who are going to kick off our conference. Dr. Nancy Ruddy, Vice President for Patient Engagement at McCann Health, is going to discuss physician-psychologist collaboration for the benefit of patients in need of mental and behavioral health services. And Dr. Ruddy is going to talk about her recent career shift in which she applies her psychological expertise to educational tools for patients, helping them manage a broad array of medical illnesses. Dr. Arthur Evans, a member of CAP, the Commissioner of the Philadelphia Department of Behavioral Health and Intellectual Disability Services, will speak from his perspective as a leader and director in the Philadelphia Medicaid Behavioral Health Program. He'll touch on many of the opportunities that the Medicaid expansion and related programs have created for psychologists who wish to improve the outcomes of patients in underserved populations. Dr. Jeffery Canter is president of Comprehensive Med Psych Systems. He will talk about a management services organization model, something you all may not be familiar with, but it's called an MSO. This model requires substantial resources and energy to launch, but it holds promise as a model that many other psychologists can plug into while maintaining their current practices and their business autonomy. We have some really brilliant psychologists doing a lot of brilliant things, thinking outside the box, and trying new and innovative ways to practice. And I am just thrilled that the 3 who you will be hearing from today were able to come and be with us and lend their skills and expertise. They are leaders in expanding practice. They are leaders in advocating for our profession. They are leaders in helping to ensure a bright and positive future for professional psychology. So I hope that you will come away from this leadership conference inspired to take up professional challenges, excited about expanding the spectrum of your practice, whatever and wherever that may be, and even more committed to working to build a bright future for what I think is the just most awesome of professions, and that is the profession of psychology. Thank you for all that all of you do for all of us and for our patients, and have a great SLC. Thank you.